Hello everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. In this video, I would like to talk about 3 huge risk factors for dementia, which I believe barely anybody is talking about in mainstream medicine, in the mainstream media. These are 3 risk factors that I would like people to be aware of. Now, dementia is an absolutely devastating illness, not just for the patient themselves, but also the family. As a hospital doctor, I see dementia all the time, and it really does exert a huge toll on so many millions of people out there. It takes away anybody's personality, who they once were, and they are left a shadow of their former selves. A horrible, horrible illness. And statistics suggest that 1 in 2 people, think about that, over 50% of people will get some form of dementia if they live long enough. And that's why I want to share this message with you in this video. And this is especially important for anybody over the age of 65, which is the big risk group for getting dementia. Here we go, 3 to remember that you may not have heard anywhere before. Number 1, hypoperfusion. What is hypoperfusion, you may ask? This is a strong hypothesis of mine. Let me paint a scenario for you, and I've talked about the phenomenon of overtreated blood pressure in previous videos. But somebody in their 50s or 60s might get started on blood pressure pills, and these will slowly add up. 1, 2, 3, sometimes 4 or more blood pressure pills. And they'll be put on these medications by different doctors, different specialists. There will be 0 communication between different specialists. And before you know it, someone is over-medicated. And what tends to happen is with age, as one ages, as people are hitting maybe 60 and over, their great blood vessels around the heart tend to stiffen. And blood pressure tends to go up in a lot of people. And we're overly aggressive about treating that. But aside from that, at extremes of age, blood pressure starts to fall. And there are lots of people out there in their late 70s, 80s, even 90s who are very likely over-treated with blood pressure pills. And their resting blood pressure, their systolic blood pressure, the top number might be in the low 100s or even 90s. And as well as making people dizzy, lethargic, prone to falling, it also results in hypoperfusion to the brain. And if the brain isn't getting enough blood, what do you think happens? That is likely to result in consequences, including eventually cognitive impairment. This is a strong hypothesis of mine. I believe it makes perfect sense. I would like to see it studied much more. Unfortunately, so many people out there, maybe even somebody you know, is at risk of hypoperfusion, which will increase their chances of cognitive impairment. So if this might be affecting you or someone you know, think about it and speak to a good doctor. Number 2, isolation. This is a massive problem across the Western world in particular. As people age, they can get more and more isolated. Their spouse may pass away, their children may live far away, and they aren't really interacting with people regularly. Human beings by nature are social animals. Of course, you want to be in good company, you don't want to be in bad company, but most human beings should be regularly interacting with other human beings. The brain is like a muscle, and when we interact with people, when we engage in meaningful conversations, we are using vital parts of our brain. And of course, like any other muscle, if we aren't using it, it wastes away. This has actually been shown in research. According to the United Kingdom Alzheimer's Society, the more isolated one is, the more the risk of dementia goes up by over 50% in those who are the most isolated. So it's definitely something that anybody should avoid in old age. Again, you want to be with good company. It can even happen online nowadays, but you should regularly be interacting with people. You cannot be isolated. Throw in a few other brain activities, mind activities to keep your brain sharp. I've talked about that in previous videos, and that should at least help with combating this very widespread problem. Number 3, insulin resistance and metabolic syndrome. I'm going to tell you something that you probably haven't heard either, and that is insulin resistance and dementia have a direct relationship to each other. Insulin resistance, of course, is a subject that I've talked about many times before. It's widespread in society and it's getting worse all the time, and it will continue to get worse. And the main reason for that is a very poor diet. high in carbohydrates, ultra-processed foods, and sugars. The mechanisms behind the progression of insulin resistance, type 2 diabetes, and dementia share similar characteristics in terms of baseline inflammation and the risk of neurodegeneration. Insulin resistance has also been shown to directly affect signaling pathways within the brain, and that is why there is a large school of thought, which I actually subscribe to, that dementia should also be known as type 3 diabetes. You probably haven't heard that before either, but there is a lot that is currently being written about this phenomenon. The link between insulin resistance, type 2 diabetes, and dementia. Unfortunately, a lot of older people out there get stuck in very poor dietary habits, rich in those ultra-processed foods, carbohydrates, and sugars, which are going to cause insulin resistance. And what older people should be doing to lower their chances of insulin resistance really taking hold and type 2 diabetes getting worse is focusing on a diet rich in the good foods, including protein intake, optimizing protein intake, antioxidants, and also fats. Remember, the brain is 60% fat. Quite why we still have that aversion to consuming fats when carbohydrates are actually the problem, I do not know. As long as you're not going over the top and you do everything in moderation, fats are good and should be a core part of anybody's diet at any age. And even if you have type 2 diabetes, it is always best to work on naturally reversing this. It is a fallacy to think that we quote unquote control type 2 diabetes with medications and insulin. Yes, you might fix the number, but the upstream problem is still there, and it's still going to contribute to increased dementia and neurodegeneration risk. So let's go over these 3 risk factors again, which in my opinion are absolutely huge for dementia. Number 1, hypoperfusion. Number 2, social isolation. And number 3, insulin resistance and type 2 diabetes. Of course, there can never be any guarantees in life. People might have none of those risk factors and still get dementia, but all we can do is go on the real science and do our best, each and every one of us, to lower our risk of future illness. Beyond that, there's nothing else we can do, but it's on us to minimize our risk for any disease in any way possible. Dementia is absolutely devastating, and I wouldn't wish it on anyone or any family. Thanks everyone for watching. Feel free to comment down below. Let me know your thoughts, or if you know any other risk factors for dementia, let us know down below and share with us what you're thinking. I appreciate all of your comments. Check out my Health Academy and my free newsletters, including a newsletter for naturally reversing type 2 diabetes and insulin resistance. For anyone who is interested, those links are down below. Hit the like button if you like this video and the bell button for more similar videos in the future. That really helps with the algorithm and getting these videos shared as widely as possible. We will speak again very soon.